Now I'd like to look at this from the patient point of view. And my first question is, how do you deal with the potential conflict of interest when you are both prescribing and supplying the drug? I mean, how as a patient can I be confident that you will recommend the best for me and not just the thing that makes most money for you?
The final thing that I'm going to say about this is that when we're prescribing, we may need to make sure that self-interest is taken off the table. If we're prescribing with our own commercial gain in mind, then we're not following the ethical and legal practice associated with the responsibility of prescribing that's being conferred on us. So that's difficult if you're prescribing privately. Are you making the right decision for the patient, or are you making a decision that makes you more money? And so therefore, you need to make sure that all your practice is evidence-based, that you engage the patient in the decision that you make, and that you're documenting that, and you can honestly justify your decision for prescribing is in the best interests of that patient.
Thank you for clarifying that. Now, what tips can you give? I mean, what questions should a patient ask to be sure that they're dealing with what you might call a proper or ethical service?
If you're a patient looking to engage in weight management, your safety and security in terms of the service that you're receiving and ensuring that the medicines are what they say they are is of paramount importance. There's nothing more important than your health. So therefore, do your research to make sure that you are engaging with a bona fide service. You can, if you're using an online service, then make sure that they are on the GPHC register. There should be on the website a sign that indicates that they are GPC registered, but don't just take a logo as being registration. Go onto the GPHC register, check the number, and make sure that this is a registrant. It doesn't mean that that practice is going to be bad or good, but it's the first step to make sure that they are at least being overseen by a regulator. Then I think it's important to look at the service that's being offered. Is the prescriber and the organisation competent to prescribe in this area? Do they have the appropriate licenses to prescribe and supply, which leads back to the GPHC, but it could be GMC if it's a doctor. And as a patient, are you receiving good information about benefits, risks, and side effects of treatment? If you're only being told of the benefits, then for me, that would be something to raise some concerns and alarms. And also you should be being told, and it may be in the small print, that this is an off-label use of semaglutide if it's Ozempic. There's questions as well about how are you going to be supported in your weight loss journey? This is not a small undertaking financially or physically. It is going to affect how you feel. It'd be very unusual if it didn't. So how are you going to be supported? How can you contact the prescriber and the supplier if something doesn't go as expected? Because it may be that you can't quickly access your GP if there's a problem. Are you being informed about some of the more serious side effects and what to do, for example, acute pancreatitis, and what the signs are for that, so that you're ready to go to hospital and A&E if some of those signs appear? When it comes to using a particular face-to-face service, you'll know when you go into it, is this somewhere that feels professional? Does it feel like a clinical environment where people are well trained and know what they're doing? Does it feel like they've got good safeguards in place in terms of the interaction they have with you, the information they take from you? Are they asking about previous medical history, family history, any drugs that you're taking at the moment? That will give you a clue about whether they're covering all bases. So I think that's probably all the questions. But if your gut is telling you this doesn't feel right, then it probably is not.
Standing back a bit, these drugs have been described as game changers in obesity management. Would you like to put them into perspective for us?
I think something that we should really reflect on as we consider this new group of medicines that's going to be available to the public is that it is incredibly important to address the issue of being overweight and obesity. It isn't about celebrity necessarily, and the media headlines around getting slim for the red carpet. For me, it's about helping those individuals who have for years struggled with being overweight or obese, are now heading to perhaps a shortened lifespan, a life that's where they have to take lots of medicines for things like cardiovascular disease, they're at risk of heart attack and stroke, type 2 diabetes, and all that goes with that. And not feeling great and living the best life they can. So these medicines potentially offer a game changer for people, and used responsibly, safely, with the right frameworks, I think they could be brilliant. And we're already seeing people that are having great effects. However, as a pharmacist, I feel incredibly responsible and accountable to make sure that this is done in a way where people are kept safe, and that we use the medicines as they're intended, and that people do get the benefits that they need. What we don't know is any long-term data on how they're going to affect people longer term. So we, like any new medicine, we need to bear that in mind and continue in our sort of safe and responsible practice to help patients.
Deborah Evans, thank you very much for sharing your insights and experience with us today. It's a fascinating story. For more information about Remedi Health and Deborah Evans' work, please visit our website using the link in the description, and be sure to subscribe for more news, videos and journals. For updates straight to your inbox, please follow the link below. And thanks for watching.